Happy Friday! Happy Friday! Happy Friday! We have beautiful snow here in Michigan. I'm curious what you guys are having out there. Dr. Nicole Coleman here. Today, I want to talk about what I want to happen, why I went into business. I guess I really haven't said this out loud, so it's time for me to say it out loud. When I worked in an outpatient clinic as a physical therapist in a large hospital system, I saw that the ability for me to provide the highest level of care that I wanted to was limited. And it was for several reasons. First of all, I felt like I had to see too many patients to really be present to them and really help them with their issues. Second, I ran out of empathy because I was seeing so many patients, so I didn't really feel like I was helping anyone. Third, the ability for me to collaborate with other healthcare professionals was almost nil. And occasionally, I saw pelvic floor full-time. Occasionally, I had the opportunity to refer a patient out, to have someone take a closer look at their hip or their back or something else that was bothering them, that was preventing them from getting better. And, I have a lot of skill sets and, I should be able to assess those things, but I had very limited time with patients from appointment to appointment, as well as the number of appointments. Because I was so full, I really had to make the best of the time that I had with them to focus on my specific niche, which was pelvic floor. So I always felt like I had to play this game where I was choosing what's important. And insurance comes around, well, what am I treating them for pelvic floor? So if I start treating them for low back or hip or knee or foot or ankle or shoulder, the insurance company is going to question what I'm doing and they're going to deny. And then that goes to the patient. So I always felt like I was just like, pulling on the end of a rope that was attached to nothing, essentially. And these three things made it really difficult for me to ever really feel like I was making a difference. And so I got to the point where I realized that I was never going to feel fulfilled, satisfied, or that I was really helping anyone in my current situation. And the universe spoke to me and said, Nicole, it's time for you to go out on your own. It's time for you to carry out something. And that is the biggest thing, which is encouraging and enabling other therapists and businesses to do just that, to be present, to not have to see so many patients that they could be present and not run out of empathy, but also collaborate and coordinate so that the patients were getting what they wanted, not limited by insurance companies. I'm going to have to go back and rewatch that because that's like the key, the essence of why I really went into business. And it just kind of came out of me. So those few things were really important. And what I dreamed about when I left and I started a consulting business for consulting was to help clients, which are business owners, as well as clinicians, be able to incorporate things that their patients were needing that they were potentially missing. I'm in Erin LeBauer's Platinum Mastermind, and a lot of people have cash PT businesses, and they talk about, raise your rates. That's one big thing, is how do you serve your clients better is by raising your rates so that you don't feel like you need more clients to pay your bills. You can be more present to the clients you have. And I see that as needing to feel confident that you can really give that patient what they need and that you have that extra something that patient would benefit from. And to me, that's pelvic floor. And the reason I think it's pelvic floor is because we have a general understanding of the human body, biomechanics, motor control, exercise physiology, how the joints themselves work. We have assessment tools for individual areas like the shoulder and the low back and the neck and the hip and the ankle and the knee and the elbow and the wrist. We have assessments for all of those areas. And oftentimes many of us choose to kind of hone in on one specific assessment type, and we tend to use that more than others, like a skill set. Some people claim to, they use FMA, SFMA, Gary Gray, MDT. Help me out, guys. Tell me what else you use. But it's generally like your go-to thing that you use, and you have these other skill sets that support you when that doesn't work. And what I see is that very, very few of us have learned anything about the pelvic floor. A lot of us know something about the shoulder. A lot of us know something about the back. A lot of us know something about the hip and the knee. And we generally feel confident that we could take a patient through an assessment and design a plan of care, a treatment plan, and get them better. That's what physical therapists are designed to do. But what I feel is that physical therapy school is missing this chunk of a huge part of how the body functions, the pelvic floor, for many reasons. The pelvic floor itself exists and does a lot of things that help support continence and sexual function and elimination, but also with generating power. And when we're talking about biomechanics, motor control, exercise physiology, for us to completely ignore a certain part of the body is just madness to me. It'd be like, okay, I want you to help people get better with their necks, but I'm not going to treat you anything. I'm not going to teach you anything about the scapula. And some people would say, okay, I can get people better without addressing the scapula, the shoulder complex. But most of the best therapists that I know have a comprehensive approach. And that's where I saw this thing of comprehensive just kept coming out in front of me. I wanted comprehensive to be where physical therapy, the profession, is going. I want us to have a comprehensive approach and a comprehensive network. All right. And so when I say that I want physical therapists to be able to confidently assess and do some treatment for pelvic floor, I don't want to convert everyone into being a pelvic floor physical therapist. I just want people to get what they missed in PT school in a way that makes sense, what they do to bring it full circle. And to get the word out that the pelvic floor plays a huge role in how we breathe, how we activate the core, how we move, how we generate power, how our pain is affected. The anatomy, the physiology, so the structure and the function of how the pelvic floor fits in with everything else is so vital that it's just blinding to me that we're not talking about it more in our courses. When you go to assess, what indicates a poor core strength. We've got, some things like straight leg lift, double knee, foot tap. It talks a lot about transverse abdominis activation and pelvic alignment, but we're not learning about core in terms of what the pelvic floor is doing. And because we're so uncomfortable with it, we just completely avoid it altogether. To me, I think that we're missing something huge in how we approach physical therapy in general. I think that we're missing something massive here. And I think it's limiting us from feeling confident when we go out and say, you know what, Mrs. Jones, Mr. Smith, I'm going to provide you with the best possible care. When we go out into this world of cash PT, some of us aren't, some of us are. So if you're not, just generally saying I'm the best that you can find, whether it's in network or not, is really something that we've worked towards. But why wouldn't we incorporate the pelvic floor into some of these things if we really want to say that we're the best? We're going to give the most comprehensive approach and treatment. And a lot of us want to be like the go-to, the expert. And I think that this gives us that extra. It gives us that little bit that allows us to transition into that, to say, you know what, I am worth X amount that I'm charging you because I'm going to give you the outcome that you truly desire. I'm going to look at you from a comprehensive approach. I'm going to talk about your body as a unit. I'm not going to neglect something in that approach, all right? And the pelvic floor to me is something that is huge when it comes to treating almost anything. So it's really easy for me to talk about how the pelvic floor impacts low back pain and hip pain because direct connections, fascial, muscular, neural connections, attaching to some of the same bones, affecting some of the same joints. Excuse me. But to convince you that your pelvic floor plays a role in your knee pain or your shoulder pain, it's a little bit hard of a sell, and I get it. It's because it's not that direct connection. But I can tell you that when you generate force for movement, whether it's overhead movement or taking a step down the stairs, your pelvic floor should be working. So therefore, I see movement of the entire body as something that is affected by the function of the pelvic floor. And the goal of the section on women's health through the American Physical Therapy Association was by the year 2020 to have a comprehensive course of pelvic floor in each DPT program. This is totally falling short for a lot of reasons. I'm not going to blame the section on women's health because they're doing everything they can. But the profession as a whole, we haven't really quite grasped that this is something that we just need to start talking about. And no one's teaching us how to talk about it. So we don't know that it's important. We don't know how to talk about it. So how are we going to incorporate it and have that comprehensive approach if all of those pieces are missing? Notice here that I haven't said that you've fallen short, right? Okay. Your educational process has failed you in some way. Your continuing education courses have failed you in some way by not bringing this extra piece that allows you to understand that the whole body works as a unit and that it's comprehensive. And these are the reasons why I went out on my own to start my own business. Is because I thought we as an industry are missing something big, a key piece that helps us have that comprehensive approach. I talk about becoming the complete physio. This is one of them. This is knowing that you've got that little extra that other people don't, is to confidently ask people about their pelvic floor function when they come to you for something like balance, low back pain or difficulty achieving PRs with sport, kneeling down to be able to pick up their child. We're not asking people, do you leak urine ever? Or do you ever have pain in this area? That's because no one taught us, all right? And this is my goal. What's up, Erin? How's it going? This is my goal, is for all physical therapists to have the ability to believe they have a comprehensive approach to physical therapy. And within that comprehensive approach, I truly believe that the pelvic floor fits into there with the ability to ask 7 simple questions, and do a real simple assessment that requires absolutely zero internal assessment or touching in that area. If all physical therapists had that in their tool basket, I would feel that my purpose has been achieved, okay? I'm not trying to convert everyone into being pelvic floor PTs, do internal stuff, poking and prodding around in that area, all right? A lot of physical therapists don't even touch their patients. And that's your choice. I completely support that because you have invested time and money into understanding how the body works from your approach. But I can honestly not think of any particular approach that wouldn't be just extra special without including the pelvic floor. I just can't think of any approach. Whether you're treating 90-year-olds in a rehab facility or you're working with 10-year-old gymnasts, the lifespan of how the pelvic floor impacts us is throughout the entire lifespan and the entire trajectory of all the ways in which we encounter patients for physical therapy. So this is why I went out onto business on my own. And this is my dream, is for all physical therapists to be able to have a conversation with their patients about leaking urine, about bowel function, about sexual function, about pain in that area. To be able to talk about it and to be able to do a simple screen of their pelvic floor and then be able to incorporate some simple things into their already well-established methods. That little extra something that just totally goes over the top. And knowing when to refer as well, right? Like we can't do it all. We can't expect that we can treat something very, very difficult with a skill set that we don't have. So if you have a patient that tells you like they're constantly leaking urine, I would say, you know what, it's probably a good idea to refer them onto a pelvic floor physical therapist, okay? Notice also that my goal is not for everyone who has some form of pelvic floor dysfunction to get referred on to a pelvic floor physical therapist. I also don't believe that this is necessary because there are a lot of simple things that we can do as physical therapists, tools that we already have in our tool basket that can improve their pelvic floor function and their experience of that pelvic floor function, their interpretation of it. You already know so many different ways to work with the hip. The hip directly impacts the pelvic floor. You already know so many ways to work with balance. The pelvic floor impacts balance. I could go on and on and on, and I could talk about every athletic sport. I could talk about every biomechanical movement of each joint. I could talk about each function, each injury, each area of the body that we treat, but I still see no possible scenario in which the pelvic floor doesn't fit neatly into having that comprehensive approach. I just don't. If you think that I'm wrong, please tell me, because maybe I'm missing something here. But I would love for us to all have this revelation that the pelvic floor within the physical therapy world is not a separate niche. The pelvic floor is part of the body that we treat. It attaches to joints that we already treat. It attaches and has similar myofascial connections to areas that we already treat. So this is why I went out on a business, and this is what I want to help people with. I want to help business owners. I want to help clinicians get to the point where they realize, okay, pelvic floor is something I should be talking about. I should be able to talk about it with a colleague, with a patient. I should be able to incorporate some simple assessment techniques and treatment techniques. I should know how and when to refer. That is what I want to do, and that is what I'm here for. That is what I'm doing through my business, Coleman Concepts and Consulting. Concepts and Consulting. Ta-da! So if you're wondering if there's any way in which I could help you, I would love for you to reach out to me and have a conversation and say, Nicole, is there any way you can help me be that little bit extra, get that better, more comprehensive approach? Could you help my business be a little bit more successful? I'm not going to say yes, right? Because it's ridiculous to say I can help everyone. But more than likely, there's some way in which I can help you think about having a more comprehensive approach and help you have a more comprehensive approach to running your business and treating patients. So that's what I wanted to get on and tell everyone about is my dream. I have a dream of a world where all physical therapists talk about, assess, screen, have simple treatments for, and refer for pelvic floor. I want you to be part of that with me. I want to move the profession forward. I want to lock arms for this movement. And I want it to be something of significance because ultimately our patients are going to get better. It's going to help your business thrive. It's going to help you feel more confident. It's going to help you become the more comprehensive physical therapist where people are going to have more respect for you. You're going to get better referrals. You're going to be able to charge what you think you're worth or you want to be feeling like you're worth if you're cash PT, or let other people know that we're the in-network clinic that truly has a comprehensive approach. Like it does all those things. And I hope that I find a way to communicate that to you guys because what's in here needs to get shared out there. So I'm just going to keep trying to do that the best of my ability. I want to lock arms. So if you are ready to lock arms for this movement, just type in the comments, lock arms, and I will reach out to you in some way. I'm excited, you guys. I'm pumped. I've been talking about Agni all week. This is why I have it. This is what it's for. Got the fire, got the excitement, and I want you to have it too. So with that, have a wonderful Friday, a great weekend. Thanksgiving is coming up soon. I hope that you are able to connect with family members whom you despise, as well as those whom you love. And I'll be talking to you soon. All right, bye.